Well, a very good morning to you. This is your world. It's actually the last Monday of the month of January. So I hope that you've had a better start to the day. I know the January feeling is like, whew, finally, it is done. So I hope that you're doing well this morning. Welcome to the show. This is your world, and my name is Winnie Lubembe. Of course, today being the 30th of wait, no, it's not the the last Monday of the month of January. I thought it was the last day of the month of January. We still one more day to have one more day to go. And of course, today being the 30th day, that is of January, it means that the world is actually marking the World Neglected Tropical Diseases Day. And I know we have a lot of questions surrounding the same, so again, not to worry, because we'll have all the answers by the end of the show, because again, skin diseases are the third most common cause of illness and one of the top 10 causes of disability, and this is according to the World Health Organization. Well, more than half of the 20 neglected tropical diseases have skin manifestations and are frequently accompanied by stigmatization, exclusion, and distress. So, as the world marks Neglected Tropical Diseases Day today, WHO is calling on everyone, including leaders and communities, to confront inequalities that drive NTDs and make bold, sustainable investments to free over 1 billion people who live in the most vulnerable communities from the cycle of poverty and are affected by NTDs. But the question is, do we even know what neglected tropical diseases are? Well, we'll be finding all the answers by the end of the conversation today. And of course, that is what we're asking you. And that is, what exactly do you know about neglected tropical diseases? Once again, what exactly do you know about neglected tropical diseases? Interact with us on our social media platforms at NTV Kenya, both on Facebook and on Twitter. And if you want to call in live and also ask your question away or share again your experience, of course, that is allowed. The numbers will be down on your screen in just a moment. But we're asking you, what exactly is it that do you know about neglected tropical disease? And of course, to help us with that conversation, we have Dr. Gina Muthoni, who's a Senior Medical Manager, Drugs for Neglected Diseases Initiative. So good to see you this morning. How are you doing?
Very fine, thank you.
Karibu sana to the show. Most welcome. And of course, we'll also have Luke Kanyangareng, who is a recovered leishmaniasis patient and Senior Nursing Officer, West Pokot County. It's so good to have you this morning, all the way from West Pokot. Karibu sana. Listen, I forgot how to say hi. I know Karam Nyoman, but what is the question?
When you want to ask somebody, how are you?
Yes.
You can either say Poishakwa.
Poishakwa, yes.
That is when you are talking to many people.
Yeah.
And when you are addressing one person, you say Poishoni.
Poishoni, yes.
Then you say Karam Nyoman.
I know. I mean, listen, it has been years.
Exactly.
Since I was there. So,
yes.
What your West Pokot, Karibu Disana to the show. It's so good to have you, Luke. And thank you really for making time for us to just come and help as many people understand what neglected tropical diseases are based on your experience. So, asante sana. But before we get to the conversation, of course, let's first of all just get to understand what neglected tropical diseases are. And again, according to the WHO, if we can have some of the graphics as far as what neglected tropical diseases are. And again, the WHO says neglected tropical diseases are a diverse group of 20 conditions, 20, all right, that again are mainly prevalent in tropical areas. But this, again, like I said, are a group of diseases that cause substantial illness of more than 1 billion people globally, all right? So what are some of the examples of the same? Well, it is a lot, and I won't promise that I'll go through all all of this, because again, but we have cases of, like, for example, elephantiasis, we have trachoma, we have snake bite and venoming, we have soil transmitted helminthiasis, and we have rabies, we have scabies, we have leprosy. I mean, I'm pretty sure we've heard about the same. We have, is it Beruli or Beruli ulcer? And then we have Chagas disease, and then we have dengue, all right? We also have chikungunya as well. I'm pretty sure you've heard about it. And then we have, that one, drunkardliasis. All right? And of course, all these other names that I promise you, I'm not going to try and go through all of them, but we also have leishmaniasis, all right? And we have mycetoma, amongst so many others. And remember, these are just a few. Remember, we talked about 20 of them. And of course, Dr. Gina, I know a lot of people are like, what exactly are these? It's too much. The names are just too difficult to even pronounce. But just break it down for us. First of all, the term neglected tropical disease.
Okay.
Yeah.
Thank you very much. So neglected tropical diseases are a group of diverse diseases that generally affect the poorest of the poor
Okay.
in society.
All right.
People in marginalized settings, conflict areas, and they are largely preventable. But because they affect very poor people, they're not prioritized.
All right.
Yeah, and these are people who do not have a voice, often do not even make a statistic when they're sick or when they die because of these diseases. So there's also little incentive for development and innovation for these diseases because those who are affected are too poor to afford the care.
Yeah.
So, and as we call them tropical diseases, they'll be around the tropics, which is around, you know, the countries which are at the belt around the equator, which are countries where the climate is usually warmer, wetter, more humid. So it actually facilitates the transmission of these diseases because most of them are vector-borne.
All right.
So in short, that is
exactly what it is.
yes, yes.
And you said mostly affects the poorest of the poor.
Yes.
Why is this? Why is this the case?
Because they occur, okay, as I said, a lot of them are vector, transmitted by vectors. And these will occur probably in areas which are very remote, in conflict zones. Yeah, so that is why these are the kind of patients who tend to get exposed to these vectors and the conditions that lead to the transmission of these diseases. Also, women and children are disproportionately affected by neglected tropical diseases because of the work settings they find themselves in or the kind of chores that they do, so they get exposed and facilitate the transmission. Yeah.
Yeah, and you know, lots of people will have questions in terms of, so do these vectors then know where they thrive best? Are there conditions maybe in those areas that sort of help them to quote unquote thrive there that then end up affecting those people? Or what exactly is it that promotes of a conducive environment for these vectors to, you know, thrive in those areas, to sort of like quote unquote again select, you know, who to affect most. But before that, let's talk to Luke. So Luke, you were diagnosed with, again this time, leishmaniasis. Is that how it's pronounced? Yes. Leishmaniasis. So when exactly was that, and what exactly happened in terms of like the symptoms? What is it that you noticed that took you to the hospital?
Yeah, that was in 1989.
All right.
Around September, October. That is when I was preparing to do my KCPE examination.
All right.
In my primary school. So I felt sick just like when someone has malaria. I felt some headache, chills, a lot of fever. Then I thought I had malaria.
Okay.
So I went to seek for treatment in a nearby dispensary, which was called Kodich dispensary by then. And it is still called Kodich up to now.
Yes.
So I went for treatment there. I was given treatment for malaria because Kodich is just a small dispensary which did not have any laboratory tests. So I got the treatment based on clinical features, and I took the pills, but did no good. I went back to school, and because I was preparing for an exam, I couldn't leave school. So I continued staying in school while taking the medicine. I continued being sick until I finished my exam. That was in around November. So I was still unwell and went back home.
Okay.
So I joined my mom when I was now growing thinner because of the sickness.
Okay.
I never had appetite to eat anything, so I grew thinner and thinner. And when I joined my mom, she was really shocked to see that I was very sick. She took me to another hospital, Kacheliba. And in Kacheliba, everything was tested, malaria, typhoid, and any other things. But it all turned negative.
Okay.
I was given treatment based on clinical features, but still I got no better. I continued getting sick until around January, when I was supposed to join Form 1 like the other colleagues of mine. Of course, I passed my exam, but I did not join Form 1 like the others because I was very sick. So after getting treatment from Kacheliba and did not recover, my mom took me back home, and she decided now to resort to traditional medicine, which still did not help me because the diagnosis was not yet made.
Yeah.
So I stayed at home. She used all that she had until she lost hope. So we stayed at home, waiting for any fate.
So at this time, where again, so no proper diagnosis, has already been made, you're losing weight,
Yes.
you do not have appetite. Any other symptoms that you experienced?
No appetite, body hotness,
Okay.
headache, feeling cold all the time,
Yeah.
and a lot of weakness of the body. So those were the major signs I was feeling.
That you had.
Yeah.
And
Then-
Dr. Gina, it's very easy for people to confuse. And you know us and the bad health seeking behavior that we have, we tend to self-diagnose. We'll be like, yeah, naumwa kichwa, nasikia fever kidogo hapa na pale, so definitely we qualify and say hii ni malaria, right? And not any other thing. And based on what he's saying, I mean, these symptoms sort of like mimic any other disease, and of course malaria again being one of the commonest diseases that we tend to sort of like fall back to when we're self-diagnosing. So then how are you able to tell the difference between this is malaria and this is this other condition?
Yes, so correctly, a lot of people who suffer from leishmaniasis, it gets confused for a lot of other, like malaria, typhoid, before the patient actually gets treated for leishmaniasis. If they're even fortunate enough for it to be diagnosed correctly, they'll have gone through a lot of other treatments. And unfortunately, leishmaniasis is the second largest parasitic killer after malaria. And it's often hard to diagnose or misdiagnosed. So, and again, because it's a neglected disease, you find that even healthcare workers are not very much aware about it, unless they're working in endemic areas. So one of the things is really to sensitize even the health workers and to train them so that they have a high index of suspicion for this disease and be able to identify the signs and symptoms and then also do the appropriate diagnosis. Now, diagnosis for leishmaniasis is also a bit complex in the sense that it requires highly skilled medical practitioners because one of the tests, which is what we call spleen aspiration, where you have to put a needle inside the spleen to get a sample, then prepare a slide and look at that slide under the microscope, is quite an invasive test and it's risky. So you need someone who's medically trained to be able to do this test. Then you need lab technicians who are also well trained to be able to identify the parasite when they look at the slide and not miss it, because a lot of the times you can miss it. So you'll find the patients have been treated for, multiple times, malaria, typhoid, other things, and they're not getting to the root of the problem. So it's very important to train health workers, to train lab technologists to be able to identify this. And also we need to get simpler and better diagnostic methods that are less invasive, that make it easier to be able to diagnose and to identify this disease so that we're able to go towards eliminating it. Because if we can't identify it, we can't treat it. If we can't treat it, then we can't control it.
That's true.
So so diagnosis is a key
it's a very
factor.
big key. In terms of sort of like helping manage and eventually eliminating the same. You talked about endemic areas, and of course I think this again coincides with the question that I asked earlier on. What is it about these areas that sort of help the vectors to thrive in the same, and of course that in relation to the country? What are some of the endemic areas that are prone again to some of these neglected tropical diseases?
So the areas tend to be areas which are they've got extremes of climate. So you'll find maybe very hot weather, or even the fact that there are areas in which people who live there live actually in abject poverty. They're not able to protect themselves from the elements, So these are people who probably sleep outside. They're not able to protect themselves from the vectors, like having mosquito nets. They're exposed, maybe they sleep with cattle where maybe the vectors are hovering around. Then you'll find if they're in conflict areas where there's displacement, then, you know, people are not living in optimum conditions. There's not adequate health care in those areas. So those are some of the factors that, you know, make it more likely for these patients to get infected. And also the fact that being poor, that means also nutrition is a problem. When nutrition is a problem, your immunity is also down. So you might find that someone like you goes to that area, but you come back and you don't get infected because your immunity is optimum. But when your immunity is low, you're also more susceptible to getting infected when you get exposed to the parasite that causes this disease.
All right. And how then does the infection occur? Because I know, like, when you say malaria, of course, the first thing that would come to many people's mind is mosquitoes. You know, so then, and of course, now that today we're focusing on leishmaniasis, right? So how then does the infection occur? And is it the same for all these other, you know, other 20 diseases?
Okay. So a lot of them are vector-borne. So depending on what the vector is, like for malaria, the vector is the mosquito. For leishmaniasis, it's called the phlebotomin sandfly. And the sandfly, it's a tiny insect. You can hardly see it. It's just like maybe a tiny, the way a mosquito would look, but very tiny. And just the same way a mosquito would bite you at night or during the day when you're not covered by a net or you've not covered yourself, it comes and bites. And in so biting, it transmits the parasite.
So the parasite lives in the...
Yes, and it's transmitted like that. So the sandfly will pick it from one person, take it to another person, and that's how it's transmitted. And as Luke said, the symptoms are so similar to malaria because you'll have fever, though it's more chronic. Malaria is more acute. You get sick and it's very intense immediately. For leishmaniasis, it can take a chronic course where you have over 2 weeks of fever, going into even several months of fever, weight loss, abdominal pain, abdominal distension, swelling because the liver and the spleen enlarge. You get anemia, where your red blood cells go down. Those are the ones responsible for transferring oxygen around the body. Not only those ones, in this anemia, all the other cell lines are also affected. So even the platelets, which help to clot blood, are also affected. So you can have problems related to more bleeding because your platelets are affected. Then also the white blood cells, which are responsible for fighting off infection, are also affected. They go low. So that means also you're more susceptible to even other illnesses. So you get leishmaniasis and you can get pneumonia on top or other, you know, so it really complexifies the illness and makes it more complex to treat. But those are some of the symptoms of the disease.
That one might experience.
Yes.
Hey, all right, Luke. So during your exams and even after, you could not join Form 1 because you were still sick at this time. So paint that picture for us. How were you? You lost a lot of weight, you know, and all those things. For how long then did this continue? Because you did not find, you know, proper diagnosis at the time. You know, when it was needed.
It continued for like about 5 months. Because from September to January, it's around roughly 5 to 6 months. So that is the time now when hope was completely lost. And we stayed at home waiting for nothing but death. So fortunately, there was a non-governmental organization which was supporting our learning during those days. They came looking for me because I was one of the beneficiaries of the scholarship. So they realized that one beneficiary is missing. So they came looking for me only to find me lying at home with my mother, very sick, very hopeless. So they requested my mother that they need to take me to a private hospital far away from home, of which my mother consented, and I was taken to Mount Elgon Hospital in Kitale. That is where I was admitted. And within the first 3 days, diagnosis was made after a splenic aspirate, like the way Dr. Gina was explaining. That risky procedure was done on me. Lucky enough, it was successful, and the diagnosis was made, and that is when I was started on treatment. The treatment was very painful. Those days, it was an intramuscular injection of Pentostam for 30 days.
Okay.
So I had to get 30 injections.
Yeah.
And
Every single
you can
day.
remember now, I was supposed to join Form 1, but I had to finish 30 injections. That was January.
Yeah.
So I had to go and join school in around March. So I got the first injection and I thought I was going to die because it was very painful.
Yeah.
Very painful.
Yeah.
The whole leg becomes numb.
Yeah.
And it takes quite some time before the leg regains its normal power. So I really cried, but the nurses in that hospital were very friendly. They encouraged me. They gave me hope that when you finish the treatment, you will get well and you will go back to school. So I gained that courage and I had to persevere
Pull through.
to get the injections.
Yeah.
After the first 5 days, I requested them because I saw I was well. I requested if I can be released to go and continue with the remaining days of treatment at Kacheliba.
Okay.
They accepted and they released me with my drugs to go and continue with the treatment
At home.
at Kacheliba.
Okay.
So I went home and I joined my mother who stayed with me in the hospital for the remaining 25 days.
Okay.
I finished my treatment at around almost I think February, and that is when I prepared now to go to school. And I joined my colleagues in March
Yeah.
and went on with my studies.
I look at you now. Here you are, and of course, a senior nursing officer.
Yeah,
of course, we'll get to talk about that in
Yeah.
a moment. I know we're supposed to go on a break, maybe in the next like 1 minute. But Dr. Gina, very quickly, 5 months in, how bad can it get, and especially with the delay in treatment, how bad can it get?
Okay, so leishmaniasis, certainly if you don't get treatment, the patient will die. Yeah, so treatment has to occur to prevent death. And the longer it takes, the more complicated the patient gets. As I said, it can affect the liver, so you see the eyes turning yellow. It can affect the clotting ability in the blood, so patients start to bleed. They can nosebleed. They can bleed from various areas, which complicates treatment. So it can get really bad. And in terms of treatment, as he said, for decades, the treatments, and this is all because of the neglect and, you know, that it affects poor people, the treatments have not been friendly. As I had mentioned, these neglected diseases affect disproportionately women and children. So for instance, leishmaniasis, more than 60% of the cases are children. So imagine a child having to go through 30 injections every day, an injection. Even for an adult,
I mean,
it is. And this injection is not just your regular injection like a vaccine. It is a very painful injection, as he said. And before even your leg recovers, the next day, you're on another injection, another injection. Yeah? And you can imagine for children, because for an injection, you have to be hospitalized. That means the parents will also probably be there with the patient, for 30 days. They stop everything to be with the patient there. So the treatment was very intense. As a result of the work we do in our organization, in 2010, we were able to do clinical, out of clinical trials that we did, in 2010, we were able to get improved treatment for visceral leishmaniasis, decreasing the treatment from 30 days to 17 days. And this was passed into policy and, you know, implemented in countries in Eastern Africa.
All right.
So the treatment now changed from 1 injection every day for 30 days to 2 injections every day for 17 days. But it's 2 injections. It's still a lot. That's 34 injections. So treatment is not optimal. But and that is why we really want to advocate,
to raise more awareness,
and raise more awareness
on the same. Exactly. And of course, the question might be then: is there a way to prevent the same? I think we'll talk about that after the break. And of course, we all know that Kenya hosted the first International Neglected Tropical Diseases again in 2019. So since 2019, you know, some of the policies and all those things. Where are we now? You know, in 2023, I'm still talking about the same. Of course, the question on the neglected tropical diseases and, you know, the stigma that comes, you know, with the same. So how far have we come? Are there gaps, you know, that maybe have identified, and what we need to do about the same? And of course, for Luke again, would want to understand. So after your treatment, you went back to school again. How were you? And of course, the whole question about nursing, was it from the same? or not. And of course, if you also experience any other, illness, infection from the fact that, again, your immunity, first of all, was compromised, you were not eating well and all those things. So we still have so many questions, to go through. But of course, not forgetting what we're asking you, and that is, what exactly do you know about neglected tropical diseases? We've given you some of the examples about the same, and I'm pretty sure you have seen, one person or two, or maybe know a neighbor, or maybe someone in your family, who has, a case of neglected tropical disease. So what exactly is it that you know about it? Again, interact with us on our socials at NTV Kenya, both on Facebook and on Twitter. We'll be going through your feedback after the break. Stay with us. This is
Centum Real Estate brings to you 265 Elma 1 Apartments, the newest and most stylish development in Kasarani. Pay a deposit of 250,000 Kenya shillings and the balance in flexible installments or mortgage finance. National Cancer Institute of Kenya and partners invites you to join us from 2nd to 4th February at the Kasarani Primary School, where screening will be done and the public will be educated on cancer and its associated risks. The National Cancer Summit will be taking place at the same time from 2nd to 3rd at the Safari Park Hotel, where health experts will show and share best practices.
Who am I? Why am I here? What will I be remembered for?
These questions come to a man at different stages of his life.
Early for some, late for others. Yet some men go through life groping for answers.
But fortunately for you, this doesn't have to be the case.
The second edition of Man Cave is an event
where you'll get to spend time with different men, learn from those who've gone ahead of you
on the journey that is a man's life. Take a trip to the Serene Lake House, Tigoni, and experience the perfect boys' getaway. Full of fun-filled games, cars, food, nyama choma, drinks, networking opportunities. 25th of February. Grab your tickets by going to www.kenyabars.com today. The Man Cave. It's a man's affair.
Want to know the biggest story of the week? Do not worry. The Weekly Review has got you covered for in-depth analysis of politics, business, governance, as well as social issues. The Weekly Review covers it all. For well-researched, exclusive and investigative content, read the Weekly Review every Sunday on Nation e-paper and on www.nation.africa, free of charge.
Claiming your assets is easy. Simply visit UFAA website www.ufaa.go.ke or dial *361# or visit Huduma Center near you.
All right, welcome back. We're glad you're still with us. Our time is far much spent, but we need to go through a lot, right, in terms of understanding NTDs or neglected tropical diseases. And of course, not forgetting what we're asking you, what exactly is it that you know about neglected tropical diseases? We've given you some of the examples. We have graphics again to just show you what are some of the examples of the neglected tropical diseases. So there we go, the question of the day. And of course, the way you can reach us is through our social media platforms at NTV Kenya, both on Facebook and on Twitter, and tag me as well at Lubembe_Winnie. But if you have a question directly, again, to Dr. Gina or to Luke, send them our way. Give us a call. The numbers are down on your screen. But there you go, on your screens, examples of the neglected tropical disease. And of course, I was talking about during the break where, again, growing up, I saw, a number of cases, and especially when it comes to elephantiasis. So what is it that you've seen from this list? of some of the neglected tropical diseases and what exactly is it that you know about it. For example, if you know or you've seen someone, with elephantiasis, right? What exactly is it that you know about it? Or someone with, for example, what you're talking about today, leishmaniasis. What is it that you know about the same case of dengue fever? I'm sure you've heard about it, or chikungunya. Again, what do you know about it? Send them, send your responses our way, and of course, we'll try and answer all your questions as far as that is concerned. But for now, very quickly to you, Luke, right? So 1989, of course, that's a long time, right? Up until now, you went back to school, you felt better. Do you not briefly just take us through then your period in school? Did you have like maybe a recurrence of an infection or any other infection, or how was it?
Well, during the time of sickness, I was very fortunate to have not to have had any other opportunistic infection. Yeah, like the way Dr. Gina was explaining that when somebody has this disease, you are prone to getting other diseases due to the lowered immunity. So I was very fortunate because I did not have any other infection apart from leishmaniasis. So when I was started on treatment, I just got better and went to school. Also, lucky enough, I was not anemic. I did not lose my blood.
Good.
And I was not having any bleeding episodes during the sickness. So I can say I was very lucky. And even during the treatment, due to the toxicity of the drug, all my organs were good. I went through the treatment successfully without any damage to any of my organs. So I can say I was very lucky. I think by God's grace I escaped it, luckily. And I went to school. I finished my learning in high school. And I think the kind of treatment that I was given by the medical personnel really motivated me to join medicine.
Yes.
Because they were very friendly, they were very helpful to me, encouraging to me, and I had that passion of serving in that environment.
Okay.
Because when I think I stayed in the hospital for over 2 months. So I did not like the environment of the hospital, but I liked the way they were serving the people.
Staff.
I liked how they assisted me to get out of the problem. So I think I should be one of the people seeing others getting out of the same problem.
And based on what you went through. I'm just curious, like, and especially during that period when you were sick, did you face like any form of stigma maybe from the people? Because again, we were talking about this during the break, that sometimes people don't really understand about some of these conditions, that we tend to put a bit of witchcraft here and there, and all those things. So did you face any form of stigma, maybe from the people around, from the communities, because people don't understand?
No, not exactly stigma, but the thoughts of my mother and the other family members had reached that level, because they had taken me to several health facilities to seek for treatment, but there's no improvement. So everybody else in the family were thinking maybe somebody have bewitched our son, so they were resorting to taking the traditional way of treatment. So, but there was no stigma against me. But the thoughts of every other family member was that this child has been bewitched. So, but lucky enough, we got treatment.
And you became better.
And I became better.
That's good. All right. So since then, of course, this sort of like fueled, your passion. This is in terms of becoming a nurse and educating people and all those things. I'm curious to understand. So has the situation changed, especially when it comes to access to healthcare? To the people around? What are some of the challenges, that you experience even now during your practice? As far as, number one, the level of awareness, as far as neglected tropical diseases, and even access to healthcare and, the treatment process. But before that, Dr. Gina, very quickly, 4.65 million people actually received treatment in the country in 2019. We're in 2023 right now. What is it that you've seen? Have we made like any progress as far as level of awareness and tackling cases of neglected tropical diseases? What are some gaps that maybe you have identified along the way?
Yeah, okay, yes, there is progress in terms of awareness and advocacy. At least now it's being spoken about more and more. We see more shows even on TV about neglected tropical diseases, but still there are gaps. There's a lot of training that needs to be done, and health education and creating awareness, because even I can just give the example of when I talk to some of my colleagues, they don't understand what these diseases are. You know, these are things you heard about in medical school. You probably went through medical school without seeing even one case of the disease. So, and it's something you probably won't see again in your career. So, you know, it's at the back end of your mind. Yeah, so there are challenges. So health workers need to be educated, communities need to be educated. We need more diagnostics and better diagnostics, because as we said, without being able to diagnose, you can't tackle the disease. We need to have availability of medicines. Yeah, because when they run out, then yes, you may diagnose, but you can't treat the patient. So availability and also funding for that medication. So we need country ownership. We need the governments to allocate budgets to that. We need also better treatments, because the current treatments we have are not optimal, as we said. Like imagine getting 2 injections every day for 17 days. You're a child, even if you're an adult. So we need better treatments. We're looking into going into oral treatments. So we need research, development, and innovation to get these better treatments. So there's a lot to be done. But we are starting to take the steps in the right directions. There's the NTD roadmap that guides, and you know, we're working towards those goals, and we're working towards getting member states and countries to, you know, be committed and, you know, to put funding in that area and to give focus to NTDs, because without eliminating NTDs, we cannot achieve our Sustainable Development Goal 3 for 2030. In terms of health. So there is progress in that direction, but there's still a lot to be done, and a lot can be done.
I mean, listen, can we just first of all start with the names? They are just too difficult to even understand. And I know, again, when I was reading about this, it's like, oh my gosh, this is just too difficult name that sometimes even mentioning it, someone is looking at you like, wait, what? I don't know if there's a way that we can sort of like simplify some of these names so that it sticks, right? Like when you mention, for example, a case of malaria, everybody knows about malaria. And I think it's because of even the efforts that have been put, you know, in place just to make sure that, you know, the whole campaign about prevention, and once you notice some of the symptoms, get yourself to the hospital as soon as possible and all those things. So I really hope that we can get to that point where, you know, you mention, you know, leishmaniasis, and everybody knows, you know, this is exactly what it is, these are the symptoms, and this is what we need to do. But look, for you, again, so has there been progress as far as awareness and access to healthcare and the treatment process in West Pokot?
Yeah, there is progress, but I think a lot still need to be done in terms of community mobilization, community awareness. There is still a lot of an awareness within the community. And I think a lot of focus need to be put in that. And even the facilities need to be developed more, because diagnosing is the biggest thing that needs to be done in time. Because the more the delay, the more the effect of the disease to the patient. So I think there is a lot which needs to be done about the facilities, especially those facilities in the endemic areas. They need to have diagnostic knowledge, as Dr. Gina has said. The healthcare workers who are working in those areas should be trained well, so that their suspicion index is high on the same disease. So I think there is some progress, even in treatment. The kind of treatment, although it is now cut to 17 days, but it's still 34 injections. It is still a lot. So I think we appreciate what DNDi are doing, because they are working on some researches to ensure that the treatment is taking shorter days and reducing the injections now from 34 to maybe 17 only. I'm calling upon the government also to put more resources in those facilities, because if you look at the way West Pokot is situated, it's still marginalized.
That's true.
Because you look at some areas where these cases are coming from, like Amoler, Masol, those places of Nyangaita. Those places are really remote, and you can't expect that person to know immediately that they need to go and seek for treatment in as far as Kacheliba, which is very far from them. And also keeping in mind that these people come from areas where insecurity is a problem. So priorities also matter.
And even to the people themselves, again, we were talking about this during the break, where someone has to prioritize ni chakula nitatafuta, you know, water, you know, for your animals.
Exactly.
Or
water is a problem.
Yes.
Food is a problem. Security is a problem. And here is somebody who is sick, and the treatment is to be sought from several kilometers, hundreds of kilometers away. So even traveling to those places, even acquiring what to use for traveling. In fact, in Kacheliba, when I was still working there as the nursing officer, with the help of DNDI, we used to go with our vehicle, the DNDI vehicle, all the way to Amoler, all the way to Masol, to look for patients, to go and do community sensitization, so that the community are aware that when you see such symptoms for this number of days, and you have got treatment from the nearby facility, you have been treated of malaria and the fever still persists, the headache still persists, you see some bleeding episodes, some nose bleeding and so on. The cardinal signs of leishmaniasis, come to Kacheliba. We used to do that, and we have saved a lot of lives by doing that.
That's a good thing.
Courtesy of DNDI. So I think a lot has to be done. There is still a lot of sensitization for the community, so that they are aware, so that they don't think this is witchcraft. They go look for traditional medicine, and they lose their children.
That's true.
So I think a lot need to be done, and the government also should put in some resources, because if we depend on the donor funding, donor funding has some time frame, and when the time comes to the end, that will be the end. And the disease is still with us.
Absolutely. I hear you. And Dr. Gina, then the question is, so then is there a way that we can prevent this? Because again, when we talk about the curative aspect of the same, it's expensive, you know, and also takes a toll, you know, on a person, because we were talking about 30 days, but now has been reduced to 70 days, but still, you know, it's a bit difficult for the patient and to the community as well. So the question is there a way that we can prevent cases of neglected tropical diseases?
There is an aspect of, there are so many, it's multifactorial. So if we go directly to the disease, it would be about vector control, you know, like the way with malaria, you try to reduce the number of mosquitoes in the environment and, you know, that kind of thing. But then again, vector control is being affected by climate change also right now. So sometimes with this climate change, things that are happening, you find that maybe the conditions are more conducive to the vector even thriving more. So vector control, limiting exposure, meaning using insecticide-treated nets, just like for malaria, mosquito nets, which will prevent the sandfly from biting, covering yourself, you know, all the extremities so that you're not bitten, having appropriate housing so that you're covered, you're indoors when you're sleeping and you're not exposed, you know. But then there's also the bigger factors like things to do with poverty, you know, and nutrition, you know, sanitation, looking at hygiene, access to water, sanitation, hygiene, looking at access to food, adequate food, so that your immunity is okay, you know, and even education, because poverty also affects education. If you know, you can do something about it. If you don't know, you can't do something about it. So the prevention is there's so many aspects to it. But yes, steps can be taken in eliminating, reducing exposure to the vector, better nutrition, better sanitation, housing, but also being able to diagnose is very important, because if you're not able to treat the cases that are there, you won't be able to stop the spread, because as we said, the vector picks it from one person and takes it to another person. So also treatment is a way of also indirectly preventing,
yeah.
you know,
Yeah.
and being able to diagnose is also indirectly preventing and controlling
Yeah.
the disease.
Do you have like vaccines maybe for the same research?
Currently
into
not
the
yet,
same?
but there's research ongoing
yeah.
into that, and yeah, a vaccine would be ideal, but
Right?
that's very far off.
Oh,
Right
man.
now we are looking at, can we get the right treatment? Can we look at optimal treatment? Can we go to oral treatments which someone can take at home? They don't have to be hospitalized.
Yeah.
They can take it at a lower tier health facility, because you know when it's injectable you need a certain degree of professional care, you know, certain degree of qualification to be able to give that kind of care.
Okay.
So right now we have made great strides, as Luke was saying. Our organization, we do clinical trials, Drugs for Neglected Diseases Initiative,
All right.
looking for better treatments. And we have managed to improve from the 30 days to 17.
Yeah.
And from the 17, right now, we've even recently concluded a trial that gave us very good results,
All right.
where we've reduced treatment from 17 days to 14 days and replaced one injection with oral treatment. So we combine an injection and an oral treatment for 14 days. So in essence, we've reduced, we've cut down the injections from 34 and we've reduced them by 20.
Yeah.
By 20, you know, so that's a big step in the right direction.
All right.
Oral treatment, and eventually we want to go into fully oral treatment.
Yeah.
Yeah.
And look, I'm just curious, because again, Dr. Gina mentioned a case of, you know, the same way we do with malaria, sleep under, you know, mosquito treated net and all those things. And I'm thinking in some communities, maybe like West Pokot and other parts, and especially in the northern region, majority of the community is mainly pastoralists, right? Move from one area to the other. Like you talked about, most of them would sleep outside, you know, with their animals and all those things. So what would work in this case? I know we're far off from a vaccine, focusing on the treatment and making a treatment a little bit easier for, you know, the patient and even, you know, the community at large. In this case, then what exactly would work? Because if someone is sleeping outside, in this case, you know, guarding, making sure that the animals are safe, they have access to water and pasture and all those things, they can't sleep under mosquito-treated net.
Yeah, I think what would work better for them is education.
Yes.
Education in terms of awareness of this disease, education in terms of maybe bringing schools to areas where there is no schools, because an educated person knows a lot of things and knows how to take care of themselves. So I think a lot has to be done. As Dr. Gina said earlier, that this affects the poorest of the poor. Most of these communities affected, they live in a poor environment.
True.
And it is not their making. It is not their wish.
Yeah.
It is because they have been marginalized. They live in a place where nobody wants to know that they are there. These people should be assisted, schools to be rolled down to places where there are no schools, security to be beefed up so that these people can embrace education and development, because when these people are insecure themselves, how do you expect them to embrace school?
That's true.
How do you want them to live if they cannot access water? Because water is another issue that can contribute to hygiene, poor hygiene. Water is another issue that can contribute to poor health. Food is another thing. They live in a place, a very dry place, where there is no food. Maybe considering irrigation in such areas so that they can grow their own food and maybe get well nourished.
Yeah.
Because malnutrition is another problem, as Dr. has just highlighted. So I think there is a lot of things to be done.
I know. So then what is the priority? You know, what is that one thing that we need to do as soon as now to sort of help, you know, in a long-term sort of like solution when it comes to neglected tropical diseases? What is the immediate action based on your experience and of course where you come from and what you've seen, you know, the communities actually go through when it comes to some of these diseases?
Well, immediate action that should be done is maybe sensitizing the community to use the mosquito nets, sensitizing them to seek for treatment early in the right places so that they can't waste a lot of time in the kind of treatment they think can help them when it doesn't help them.
Okay.
So prompt seeking of treatment, and also use of mosquito nets.
Yeah.
So I think a lot of sensitization needs to be done.
To take place.
Yes.
All right. And Dr. Gina, as we bring this to a close, today again being the World Neglected Tropical Diseases Day, and of course we really aim to pass as much awareness as possible as far as these diseases are concerned. What is it that you want people to walk away from this conversation today? And looking at let's say 2 years from now, let's not even talk about 5, let's talk about 2 years from now, 3 years from now, what is it that you hope to see change?
Okay, so it's really great that we have WHO having recognized and, you know, set out this day as World NTD Day, because now it helps us create awareness about neglected tropical diseases. And I think the biggest thing we need is awareness, education, and, you know, for people to know about this. And by this happening, having a World NTD Day, it opens up doors for people to know about it, and even doors for funding, you know, on the same. We need really to accelerate programmatic action, to have real solid strategies on how to tackle these issues. Then intensify cross-cutting approaches where we, you know, integrate NTD treatment, you know, across other disease areas, and be able to, you know, look at it in a broad scope. And really, one of the key things we would like to see is commitment from our governments, you know, and not to solely rely on donors, but to really commit to fund NTDs, and, you know, to be able to fund the treatment, the diagnosis, and even research and innovation for NTDs. That is the only way we'll be able to progress and move forward, you know, in tackling this vice.
Absolutely. All right, and of course we hope again that you know, more will be done, because like we said, this is like a multifaceted, you know, approach in terms of prevention, passing awareness, but at the same time eventually eliminating cases of neglected tropical diseases. We have to end the conversation right now. Unfortunately, time is not on our side, but thank you very much really for coming by today. Dr. Gina Muthoni, Senior Medical Manager, Drugs for Neglected Diseases Initiative, as well as Luke Kanyangareng, who again recovered leishmaniasis patient, as well as a senior nursing officer all the way from West Pokot County. I'm sure West Pokot County, everybody who's watching us is happy to see you today, you know, coming here to talk about, you know, this, and just make sure that, again, we pass as much level of awareness as possible. We have Brenton Van Limo, you know, on Facebook says, congratulations, Luke, my personal doctor, watching you this morning. But thank you really for coming by today, and thank you for staying with us until the end of the conversation. Now I know you know better when we talk about the neglected tropical diseases. So the next time you hear this, you know, word that is neglected tropical diseases, you know what exactly it is about. And of course, again, just to help us pass as much awareness as possible and helping so many people out there understand, you know, the disease in itself. So do better, and of course, spread the awareness as well. My name is Winnie Lubembe. Have yourselves a lovely day ahead. I'll see you tomorrow morning, same time, same place, right here on Your World. But until then, stay safe and God bless. Goodbye.
I really want to get through this. So let's just forget about her and focus on you and me.
We are old partners in crime. And no, we're not friends. We're actually dating. I'm her boyfriend.
You cannot even begin to imagine the hell I've been through since this woman showed up. But you know what? All that is over now. Mickey told me the truth, and now we're going to try again.
All right, Jenny, time to go home now.
As long as you tell this woman to stop sending messages to my husband, and to stop using your daughter as an excuse to see him.
It had to be you.
To protect our family from germs that cause illness when it's cold, we use Dettol soap.
Dettol soap with germ defense gives you protection. When it's cold, germs are transferred in different ways, and Dettol soap's germ defense protects you from up to 100 illness-causing germs. Be Dettol sure.
Yo, Butru Seke, the sharp guard up in the mix, and I'm saying, NTV, shout out to you, bro. Keep it locked. Hey.
Sauti yako ina sound vizuri kwenye masikio.
I like it. Come to the dance floor, babe.
Angie.
Leo tuna festa pe banda.
Festa pe banda. Another banda.
And it's just like an amazing mix.
I am happy today. Sin como Victor.
No compromise, this the hottest combo.
On MTV, don't touch that dial. Not yet. No,
Not for the first time in its history, Juventus has been caught up in a scandal it cannot immediately escape. Deducted 15 points for improper accounting relating to transfers, Juve's Serie A season is basically over. Regardless, manager Massimiliano Allegri is determined to rally his players and rise above the scandal.
Madam. Nauza hapa maskati, nauza ma-t-shirts hapa, unaweza cheki maskati niko nazo hapa.
Nani alikwambia mimi anataka skirt?
Madam, cheki hii skirt.
Toka na hiki toko hapa.
Madam, unaona hii skirt ukivaa mbele ya mzee utamchanganyisha.
Mimi hata na mzee.
Madam, basi ndio kwa maana nakuuzia hii skirt takufanya upate mzee. Angalia.
Mimi mambo ya wazee hapana taka. Mimi anatafutia bana.
Basi sasa hii basi patie mwenye anakutafutia bwana. Madam, hii skirt ndio original.
Mama yangu yuko hapa sasa, nataka kumfosishia hii kitu.
Kwa tu hii skirt.
Hapana, mimi hapana taka.
Basi fanya hivi.
Madam,
ushashikilia skirt.
Mimi atatupa.
Madam, sio ukishashikilia nipatie tu pesa.
To get Mitumba by Crazy Kena, dial *811 929 #. Skiza, Na Nation.
NTV, turning on your world. The following program has been rated GE. It is therefore suitable for general family viewing.
We clapped our hands and stomped our feet. Hi ho, hi ho, hi ho. A rig-a-tick-tick and away we go, away we go, away we go. A rig-a-tick-tick and away we go. Hi ho, hi ho, hi ho.
Good morning. I hope you're enjoying your Saturday morning and ready for an awesome episode of Generation 3. I'm your host, Trisha Edera, and we're going to have a lot of fun. Let's get started with the highlights.
Don't let me go home. If you wanna bust. If you wanna dance. Don't let me go home.
I think a monkey would make a good driver.
I think a giraffe because it has 4 legs.
Kings and kittens knit in the kitchen.
Kids and kittens knit in the kitchen.
I think the riddle is life.
I think the answer is I have it.
So gently I'm going to do that. So just put it all the way around. And today I want to take you deep into the forest where you're going to meet Mr. Fox.
I like that. And go like this.
Stop!
watching videos. I bet you do too. Well, let's have a look at one on Awesome Video.
Prince, Mr. Masaka, don't let me go, don't let me go, don't let me go, mama. If you wanna dance, if you wanna dance, don't let me go, mama. Lega, 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 dance the reza. Lega, 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 dance the reza. If you wanna dance, don't let me go, mama. If you wanna dance, don't let me go, mama. Look up, look up, look up, bend the knee. Move like this, like that. Shake this, shake that. Moto quattro make a dance. Lega, 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 dance the geza. Lega, 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 dance the geza. Don't let me go, don't let me go. Don't let me go, mama. If you wanna dance, tupate muziki, kanyaga dunia, muziki kandanda. Look up, Mr. Masaka, kaka, chuka, kaka, chu, vunguta. Look up, pendere. Don't let me go, don't let me go, don't let me go, mama. If you wanna dance, if you wanna dance, don't let pika mama. If you wanna dance, don't let pika mama. Masaka, 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 masaka. Kids Africa, naka, 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 na. Ba wa 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 wa. Move like this, like that. Shake this, shake that. Lega, 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 dance the geza.
Here at Generation 3, we feature different kids' talents. Have you discovered yours yet? Some kids have discovered their talents. Let's have a look at them on Wakilishan.
Good morning, my name is Audrey Rosa. I am from Kinderville Junior School and I shall be playing Blackbird.
vibe corner, where we have opinion question, tongue twisters, and riddles. Let's start off with an opinion question. Today's question is, which animal do you think would make a good driver?
I think a monkey would make a good driver because they're very intelligent creatures.
I think an ostrich because it can see far and it can also use its legs on the wheel.
I think a dog would make a great driver because it has 4 legs.
I think a giraffe because it has 4 legs and 2 arms. It can use the legs to drive, and it has a long neck to see.
I think a dog because it has 2 hands and 2 feet.
Time to get our tongues twisted with this awesome tongue twister. Kids and kittens knit in the kitchen. Kids and kittens knit in the kitchen. Kids and kittens knit in the kitchen. Fun, right? You say it 3 or more times as fast as you can.
Kings and kitten needs in the kitchen. Kings and kitten needs in the kitchen.
Kings and kittens knit in the kitchen. Kings and kittens knit in the kitchen. Kings and kittens knit in the kitchen.
Kings and kittens knit in the kitchen. Kings and kittens knit in the kitchen. Kings and kittens knit in the kitchen.
Kids and kittens knit in the kitchen. Kids and kittens knit in the kitchen. Kids and kittens knit in the kitchen.
Kings and kittens knit in the kitchen. Kings and kittens knit in the kitchen. Kings and kittens knit in the kitchen.
I hope you're ready for a riddle because I'm about to riddle you. Here is the riddle. If I have it, I don't share it. If I share it, I don't have it. What is it? What do you think the answer is?
I say my answer is secrets, because if you give someone your secrets, it can't be kept again. But if you keep your secrets, you can't share it to anyone.
I think the riddle is life, because when you give life, you can't have it back again.
I think the answer is I have it. Because if I share it, I will not have it.
It's life, because you can't give somebody life. And when you give somebody your life, you can't have it back. Because if you have your life, you can't share your life with anyone else. But if you go to someone else and you give him your life, like you end your life because of him, you have given him your life and you cannot get it back.
I think it's personality, because somebody can have personality but you can't share it with others. But somebody can share their personality with you, and you might gain personality from that person.
The answer to the riddle is at the bottom of your screen. Did you get it right? If you did, you're a genius. If you didn't, don't worry. We'll have another awesome riddle next Saturday. It's time to learn something